doesn't start in the hospitals. It starts in the houses, on the roads, in the wells, the schools, and also, of course, in women's groups. Today, we're talking about communities that don't necessarily wait for solutions to come from outside because they build them. We talk about people who organize, who confront stigma, who care about people and take care of them. Today, we are traveling to Ghana, where Team Africa Aid has shown that when the community leads, health flourishes. And they do it with a powerful, courageous model where numbers speak and, above all, lives also speaks. So today we have with us Isaac Kwabena Kakbeibe, Director of Team Africa Aid. Thank you so much for being here.
Thank you too.
And on my other hand, I have Naomi Drink, who is a civil society technician in Fundación Anesbat. Thank you for coming.
Thank you.
It's a pleasure having you both here. And I would like to ask you some questions, if that's okay. So, the first question is going to you, Naomi Drink, because you obviously work in Fundación Anesbat. My question to you is, why is Fundación Anesbat committed to civil society in the fight of NTDs?
So I think one of the key things is that we recognize civil society and civil society organizations like Team Africa Aid as real key actors in the fight against NTDs. They contribute a lot to this fight that other actors may not be able to do. And I think particularly there's a real element of knowledge that civil society has of communities, of their dynamics, their traditions, their beliefs that can also really influence health practices as well, and health behaviors. And that knowledge and that experience means that they are able to carry out projects and initiatives that take into account those cultures, are really culturally appropriate, and can respond as well to the needs of people affected by NTDs and communities affected. So I think that's one of the really key things. Civil society is also really plays a key role in awareness raising and advocacy, which in the case of kind of fight against NTDs, can create real behaviour change, which has the potential of kind of long-term impact, because it's not kind of short-term momentary changes, but long-term behaviour changes in communities. For example, in terms of hygiene and sanitation practices, so things that go beyond, I guess, kind of more medical work associated with the fight against NTDs, and kind of covers a real holistic approach to this fight. So yes, I'd highlight those things as kind of some of the main reasons why we decide to collaborate with civil society.
So what do you find most valuable about the collaboration between Team Africa and Fundación Anesbat in the fight on NTDs?
I would highlight the learning that we have from Team Africa Aid. I think that obviously we're an organisation that is based here in Bilbao, and having the contact and collaboration with organisations like Team Africa Aid, and all the knowledge and experience they have, and and the contact they have directly with people that are affected by NTDs, that's something that we really learn from. So I think that we learn a lot from Tim Africa Aid and other organisations like them. And those learnings enable us to also kind of gear our priorities towards work that is going to be most impactful and most kind of aligned with the needs of affected people and communities.
Mm-hmm. Okay, that's great. Like, as you said, cultural proximity is a must, especially when working with foundations, associations, people in the global south, you know, with different cultural codes, and especially being a foundation based in the global north, we know there are different dynamics that come in with that, and that's why cultural proximity and knowledge of the territory, of its history, of the community, also build a different kind of approach, and with that, the trust of the people in the territory. So yeah, that's really good to have in mind as a foundation, you know. And so Isaac.
Yes.
How are you doing?
Oh, I am very well.
Yeah, very well.
Yeah.
Okay, so tell us about what does CISSP project mean, and if you want, you can tell us about how did that idea come out? Like, how did you really manage to think about it and put it in work?
Okay. The community integrating and system strengthening project, it is have a multi component. So it's not just a straitjacket issue. It is addressing public health needs and then designing to address challenges regarding to NTDs in Afo region and Bono region. Our main focus is to integrate clinical care, community support, and the social protection system to ensure people affected by NTD live in a dignity and have access to timely treatment and full include in the community. Because if you look at our culture setting, some of the people who are affected, like a blind person, onco-psychiatry, which cause some people to look blind, when culturally they are not allowed to go to the chief palace.
Why is that?
Yes, that is the culture we are working with. So this we are putting in advocacy, talking to those gatekeepers to accept them, because maybe it's an individual which is having eye impediment. The chief may also be eye impediment. So does it mean you reject the chief? No. So in that case, advocacy is a very strong key to address these challenges.
Okay.
Yeah. So this is just a few things about the project and where we are working. We've reached a large number of people, but going forward, I will let you know them.
Amazing. No spoilers made. Okay, and since we're talking about the project and everything, I would like to know, what have you achieved till now?
Yeah.
What can you say you've achieved?
The project lies on 4 pillars. We are into water and sanitation. We are into advocacy and education and prevention. And then the livelihood package, that is empowering people and then giving them the setup pack. And then the last one is the advocacy. If you look at the advocacy part, we're able to do a lot of screening, and then we had the affected people, which we showcase the results to most of the district assembly. I remember one time we did an advocacy meeting with the the district assembly in Esunafo North. So after presenting this, the municipal chief executive asked that, "Hey, gentlemen, where did you get these pictures from? Is it from another country, or you mean it is from my district?" So yes, this is from your district.
He was surprised.
Yes, he
Hi.
didn't know. So at that point, he instructed the social welfare officials to take responsibility so that they could support that person, those people with brucellosis and other elephantiasis, and then some blind people, to add them to a LEAP program where the Ghana government support them with stipend every month. And then if you look at the screening, it is the screening that generates our advocacy power. Because if you don't have the evidence, what shows that there are issues for the government or the municipal or the international or an advice to address. So our screening also was pushed very well. And we had experienced people to do the work for us, which we also include community health volunteers, which these health volunteers are already structured by Ghana Health Service.
Okay.
So it's not we, Team Africa, or any other will go and look for people that, okay, come and do this. It is a structured one. Okay. They support us. And then we also use the disease control officers of Ghana Health Service, because the project is actually a Ghana Health Service program. But, they can't do all. So we are augmenting their effort.
Okay.
So for that matter, we can't jump their structures and then deploy our own structures. We have to mitigate their structures and let the structures work.
Okay.
Yeah.
Yes.
And then the livelihood, the people that we identify as affected persons of NTD, we selected 100, if my memory set me right. Then we supported these people with capacity and then with a startup fund. I share with Naomi with the successes we chopped, though they are documented all right, but
they don't contain there, right?
It's
more than that.
Yes. Like you see in the video, a woman telling us that, okay, the previous years, he was fully handicapped. Right now, he can lay a hand on something that can beef up her economic life, and then changing her life status so that she's no more vulnerable to the community as a whole.
That's powerful.
Yeah.
Yeah.
So these are some of the things that we have. And not that alone, if you look at our rehabilitation centers, we actually built, we were supposed to do 4, we are supposed to do 3, and we actually did the 3. So if you go to Esunafo North Goso as a capital, we have a rehabilitation center which is functional. And if you go to Sunyana West, likewise the same. And then time the same, because it is being resourced that if you look at the people with the entities, when they go to OPD, they are kind of, people see them like other patients. So we did this rehab so that as soon as you get there, and then they'll tell you, oh, this is your clinic. You don't need to even come to the OPD to seek for treatment. So they have their own clinic.
Oh, that's very nice.
And the very last one maybe you want to know is the washrooms that we actually built. You see, NTD affect people. They go to the hospitals or health centers. So the washrooms were built in most of the health centers, and there are some communities which are fully imparted with entities. So that with this, we don't actually know where the disease is coming from. We know in a mix that it is through these sanitation issues. So these
mostly,
are some of the response that we are doing to reduce the impact on people,
Great.
the NTD issues in the communities.
Wow.
Yeah.
That's so amazing. There's a lot of work there.
Yeah.
Wow, that must be exhausting.
Yeah.
Yeah, that's very awesome. So, how do you feel gender, health, economics, and also community work is integrated in Team Africa Aid?
Yes, you see, if you look at the gender issues in most African setup, which I know you are coming from there, the gender issue happen to be a problem.
Okay.
Yeah.
A problem as how?
A problem is when the men are talking, most women shut up. They don't want to share their sentiment like the men would do. So in our programming and our program activities, what we did is anytime we are training, building capacity of people, we make sure that the women have the higher number. So that they can, women are, they are in a community, they share their own issues and they try to address issues within the household. Men, as soon as he wake up, my wife, how are you? Or maybe he may not even ask, he will go away. But the women, they take care of the house and then make sure that when people are affected, it is the women. Yeah, and then if you look at the economic part, if you look at some of the photos that I have here, the entities, I can barely tell you that about 80% are women.
Okay.
You see?
That's really nice.
Yeah, so in that case, the focus goes pretty well onto the women. Like the startup part, we train the women in local soap making so that they can sell and then be able to use these returns to maintain their life. And then some of the women also use it to expand their business, and some also use it to rear animals. Yeah, just to keep the house safe, or if they need anything, you'll be surprised that some of the communities that we visited, there were some patients that cannot even afford to buy gloves for their wounds. So when we had this section, build their capacity and give them the startup, they could buy the gloves for their wounds to be dressed. But the only challenge in it is NTD wounds doesn't go overnight. It takes a very long time. So sometimes the people feel fatigue set in. They don't say, I've been treating this for years and years. It's still the same. You see, so sometimes when fatigue set in, then it looks like hopes are pretty loosened. But we are also intensify the education that they shouldn't give it up. Yes. They shouldn't give up.
Thank you for all the testimonies you've brought up. I feel like also the human stories help us also to navigate through the work you do, because sometimes when we explain the work we do, people understand, but they don't really see the impact, right? Until you tell a story about, a person whose life has changed radically, right? So now we're going to talk about this. We're going to talk about the experience of people that have been under, your care. supported by Fundación Anesbaz.
Yeah.
What or which story has had the greatest impact on you too? Because you've heard about the histories. I know you know some histories. And why? And why was it impactful for you?
So I think it was a story that Isaac and his colleague Edward shared with me the other day when we were talking, of a lady that was supported with the economic empowerment work of Tim Africa Aid, and she was supported to do soap making, and she then shared that before this project, people didn't come close to her, and thanks to this training on soap making and being able to sell this soap, people were coming close to her again, and I think for me it really highlighted that the work that Tim Africa Aid does and civil society is doing in Ghana in this case, in the fight against NTDs. So, for example, this activity that is focused on economic empowerment, so is focused on improving the livelihoods of people affected by NTDs, but also has this much wider impact of social inclusion, of mental health, of reinforcing people's dignity. So I think for me that was a story that highlighted that one simple activity of training someone, quote unquote, of training someone how to make soap can have such a massive impact on their lives and on their communities and their place in their communities.
Oh, if she's listening to us, hi. And for you, which story would you choose?
Yes, there's one critical issue. I was in the field conducting screening and education in a community called Ayumso and Komukrum.
Okay.
And when we were conducting the screening and education, a young girl of, I think, 12, 13 years girl, the teacher pulled her to ask that we should look at this girl. So what is the problem? That the entire family have rejected her. I said, why? That she's having a sore on the leg, which the parents anticipated that it was a witchcraft.
Wow. Yeah.
So I said, how can a sore turn somebody to be a witch? That they've treated the wound for so many years and it never goes. So sadly, I asked the NTD focal person for Madame Paulina. She's a female. I said, Madam, this sore that you are seeing on this girl leg, what can you do so that this girl will gain her freedom? She said, oh, my brother, she just needs 2 injections and she'll be fine. I said, are you sure? That yes. That's okay. How much will that cost? She said, if I give her 100 Ghana cedi, so it will go. So I quickly pulled the money and gave it to her. In 2 weeks' time, that's all. It's gone. She's healed. So she has been accepted and integrated back to the society because the parents rejected her. You see, so that alone, that the girl cannot even go to school because her mates are saying she's a witch.
Yes.
The households are saying the entire community totally rejected. Wow. So that alone give me the hallmark.
That's the quote unquote simple you were talking about.
Yeah.
Because sometimes it only requires, like a very easy or simple solution, but when you don't have accessibility to that solution, it
Yeah.
becomes a bigger problem,
Yeah.
especially when, we're talking about neglected tropical diseases that are culturally very negative and they have a lot of stigma in. So that's wow.
Yeah.
I feel like all the stories I hear about NTDs in different parts of Africa right now in Ghana, we're talking about Ghana, are really inspiring.
Yeah.
It inspires us, right, to keep doing the work we do. So I'm going to ask you, what would you say to a person that is in another country and wants to do the same thing for their community?
Okay.
What would you say to them?
Yeah. What I will certainly tell organization who are doing or who want to do the work that we are doing, that they shouldn't give up. Because and then they shouldn't give up, and again they should listen to community plies, because there are some issues like that girl who was treated, and Nasva didn't tell us to treat or to give support for the girl to be treated. So it has turned a success story to us. You see, so they should intensify the advocacy. It is very difficult. Maybe they may not get it right right now, but
because
going
of the
forward,
stigma, right?
yes, going forward, they should. Going forward, they could get it, the success, because if you look at the work that we did, you will be walking and somebody say, "Oh, you came to our community." So what did we come to do? That you did this, you did this. Oh, we see you.
They'll recognize you.
You see. So let's leave potential and valuable hallmarks in our communities. We should wear their shoes. When somebody is affected by entity, the person is actually affected by mental health.
Yes.
Because imagine somebody, this picture here, this woman is, look at the picture there, if you can see it.
Show the camera.
Look at this woman here with the foot, very huge elephantiasis.
Yeah. Very
I
huge.
don't think nobody would like to even shake hand with her, or even touch her or greet her. Some of our communities think people who are affected by some of the entities are inheritance or a curse.
Yes.
So for that
It's
matter,
very spiritually related.
So for that matter, it becomes so difficult to brainwash people in these issues.
Yes.
So that's why I'm saying that any person or any organization elsewhere who is doing this shouldn't give up. Because if they keep the fight, they will save people's life. Maybe if this woman or this bunch of people, if they haven't seen us or met us, some of them would have gone even dead or out of contact. But we are here to give hope.
Wow.
Our colleagues should also try to give hope, and then share their sentiment with them.
Yeah, be like, have empathy for people. Yeah, and build also this feeling of community so that no one is left out.
That's it.
Without regarding the condition. But, it's difficult. As you said, it's difficult when there is so much associated with NTDs, with the spiritual beliefs and cultural beliefs. Thank you for your work.
Yeah, thank you.
And Naomi, to finalize, what do you feel that we need today in order to fight against entities without leaving anyone behind? What do you think it's necessary for that?
I think that the key thing is putting the needs of those that are affected by entities, particularly focusing on women, people with disabilities, and other marginalized groups that are, as Isaac was also sharing, are disproportionately affected by NTDs, both directly by the diseases, indirectly through, for example, women having to care for family members that are suffering from NTDs. And I think putting the needs of those people at the center of work, and not only kind of indirectly or not only taking into account their needs, but also involving them directly in this work, fighting against NTDs, and making them active and key actors in that work, which I think is something that Team Africa Aid has done really clearly, of involving communities, involving women that are affected, involving people with disabilities directly in their projects and in their work.
Oh, thank you so much. It is definitely difficult to talk about health without talking about dignity. And to speak about dignity, we have to speak about the lives affected. We have to, listen to the voices of those people that are suffering it, and, then that also look for a place to advocate and to speak up so everyone can listen. So, I'm going to thank you so much for sharing with us your work, your testimonies. It's really valuable what you're doing. Keep up the work. Thank you so much for coming, and we'll see you next time.
Thank you, Pendo.
Thank you very much. Thank you very much for having us.
Okay, till next time. Bye.